All right, welcome everybody. We're going to get started with this 60-minute webinar, which is talking about simplifying Canadian insurance billing. So we're talking about the direct billing features that are available on Embodia today. We're going to go through a few slides together, and then we're going to jump into a live demo. So my name is Maggie Bergeron. I'm a Canadian PT, and I'm one of the co-founders of Embodia, and I will be taking you through this webinar today. Just a bit about myself. As I mentioned, I am a physiotherapist. I did my master's at McMaster University and graduated in 2009. And I still do see a small caseload of virtual patients, but my primary job and role is with Embodia. And I do some work also with the University of Toronto, and Embodia actually also hosts students regularly for their placements. And we have 2 students with us right now who are doing a placement with us. And a little bit about this webinar. So this is the second webinar in our live and interactive demo series. The first one was last week, and it was recorded. Today's being recorded as well. And all last week's, this week's, and next week's will all be found in the same course. And you can scan this QR code. I'll also send to go to that course page, and I'll also send a follow-up email out afterwards that will have the link to that course. You are welcome to put your questions in the chat or the Q&A, and I'll keep an eye on them as we go through the webinar today. This is going to be about 30 minutes or so, and then 30 or 45 minutes, depending on how many questions there are. Okay. So this is just a brief overview of what we're going to go through together. We're going to start by just looking at where to add credentials for all 3 of these integrations, Telus, GreenShield, and HCAI. Then we're going to go through a Telus claim together. So we'll do that through Embodia. Then we'll do the same with the GreenShield claim. And we'll save HCAI for last because it's also the most complex. And maybe not everybody here uses HCAI. That's probably the one where fewer people use HCAI. It's really only if you're in Ontario and you're doing MVA billing and want a simpler way rather than logging into the HCAI website to do that billing. And just a quick look here at what Embodia is. So Embodia is an all-in-one platform. We offer everything from practice management and EMR to telerehabilitation, home exercise software, bladder and fiber diaries. You can also build your own custom diaries, questionnaires and outcome measures. Similarly, you can build your own, or you can use the templates that we have available. There's also a patient education library. Again, you can build your own, or you can use what's in our library. And we offer online continuing education through both on-demand courses and live online courses. Just a few themes on Embodia. It is very customizable and it's very flexible. So we have lots of clinics who use Embodia because they're interested in having more control over their account and having more customization. So we offer that. And we also build features based on request. If you are currently using Embodia, then you would know that if you've sent in any requests. We're pretty quick to build features or make feature improvements. And we also have something called a change log, where you can actually go and see up-to-date changes that we've made. And I can show you that in a moment. That's available to anybody if you just want to have a look at what we're doing on a day-to-day basis. And then another feature, I mentioned this briefly before, we generally have templates and build your own options. So this is true for questionnaires, such as intake forms and consent forms, diaries, exercises, patient education, and charts. If you are new to Embodia and you're interested in using our practice management system, it's $45 per month per practitioner, and it includes all of the features that you need for practice management, and that includes all of the direct billing features that we're talking about today. We have 2 other tiers. So we have some clinics who just use Embodia for exercise prescription in tier 2, and some that just use it for continuing education in tier 1. Tier 3 includes everything in the prior tiers, but it also includes everything such as the EMR and practice management system. And then just briefly, we have 2 optional add-ons. If you wanted to host your own courses and sell them to the general public or provide them for free. And then we have something called a Clinic Academy that you can add, and that allows you to host your own online courses. And if you're a larger organization and you're interested in hosting internal team training, then we have something called a Private Academy, and that allows you to consolidate your organization's documents, content, training, videos, all in one location. And there's a full analytics dashboard. So you can see completion rates, where people are getting stuck. You can have quizzes and exams in there too, or knowledge checks. Okay, so we're going to walk through the features for direct billing. So I'm just going to switch over here. And just quickly, I did mention that we have a change log. If you're signed into Embodia, there's a little option that says new on Embodia that I clicked on here. And it's going to show you everything that we've been adding. So we can see there was a new blog post published today. There was a feature improvement published today. And yesterday there was a new course and a new feature that was published. These are all clickable. So if you wanted to go and see what this new feature is, you can go and find more information. Okay, let's jump into looking at Embodia. So I'm just gonna hide marks. Okay, just give me one moment. Okay, so we are going to start under the My Clinic dropdown here. So if you joined us last week was more of a broad overview of the practice management system and the features available there. In the beginning of that webinar, we went through the onboarding checklist. Generally, the My Clinic dropdown that you'll find on your clinic account is going to have all of the things that you need to set up your account. And the onboarding checklist walks you through the most important features that you need to set up before you start using Embodia with your patients. One of the other sections that we're going to spend more time in today under the My Clinic dropdown is billing settings. So under billing settings, you'll see another dropdown of everything related to billing settings. And this is the setup of how you use billing on Embodia. The first one we're going to look at is called payment methods. Now, collecting payment on Embodia is very flexible. You can add as many different payment methods as you'd like. And some examples might be cash, check, credit card. If you wanted to collect a credit card payment, you can do that. We can see this is connected to a Stripe account. And we can see that which ones are active, meaning I can actually use them when I'm billing an invoice or collecting payment. I also have one set up for GreenShield, HCAI, and there's one down here called Telus eClaims. And again, you can set up as many as you'd like, and you can name them anything you'd like. It's very simple. You just click add a payment method, give it a name. You can have an internal name. As you can see, it's not visible to your patients, and you can provide payment instructions. A good example of this might be if you're choosing an email money transfer payment method, like you collect payment by email money transfer. Well, in the payment instructions, you could add what email they should send it to you. Okay. Let's go through adding the credentials for Telus. So there's a section here called Telus eClaims. You would need a Telus account. So that would be done on the Telus website. And then once you're approved as an organization and with the practitioners in that organization, you come to this spot and you add your location, and you can add the therapists that are part of that location. You can see that you can add more practitioners and you can add more locations. Okay. So very simple and straightforward. So you get this information from Telus, and then you just simply add it here. And you fill out the information. That's the first step for Telus. GreenShield is very similar. So recently GreenShield, or the GreenShield integration is brand new on Embodia, and really it mimics, it's very similar to Telus eClaims. Under the GreenShield settings, here you're adding providers. This is information that you get from GreenShield. So your provider would have a provider ID and a provider key that is provided by GreenShield. And again, you go through an approval process first with GreenShield. Once approved, then you can come add this information. And we'll also show you here the total claims count for each practitioner. So we can see that I've made 3 claims as a provider with GreenShield. We're going to come back later to the HCAI setup, just simply again because it's the most complex and there's the most features associated with it to improve the amount of time that you spend on any kind of HCAI billing. And I can see a few more folks joined us. Welcome again. And if you do have any questions, feel free to drop them into the Q&A or the chat, and I'll keep an eye on those as we go. We're going to go to the calendar view here. And here we can see my schedule. Now I can only see today and yesterday, but you can easily adjust your settings. So we can see that I have some hidden days here. So maybe I want to show some more days. There's some additional settings in the calendar that you can also use as you like, including how big the slot durations are. There we go. So now we can see Monday through Thursday in my calendar. We can see that I've already had some appointments today. And we can go ahead and we're going to book in a new appointment for today. And I'm going to show you how simple it is to bill with Telus. So I'm going to click on the calendar here, which is going to pull up this screen, which allows me to add a new patient, or to add a patient to this appointment, rather. We're going to add Antonio. If you were here last week, we did briefly talk about clinical cases and their usefulness. It's basically an episode of care. So it allows you to schedule appointments within an episode of care or a reason why somebody's coming in. So we can see Antonio's had a shoulder injury. If I'm seeing him today for that shoulder injury, then I can just simply click new follow-up. It'll populate all this information. So we can see that we're going to do a 1-hour PT appointment for today at 2 p.m. All of this is changeable if I needed to. The reset time is a break time. So if I needed a break afterwards, I can include that. If I don't need the break, I could remove that. We also have a reoccurring consult feature. So if you wanted to set this up every week for 4 weeks, you can easily do that. And we'll just give you a little warning. We're not going to block you from being able to book this appointment. We're just showing that this selected time is in the past. And for each appointment, you can have a consent form. You can customize the emails that go out. And then there's many other settings that you can include, such as the option to attach additional questionnaires. I'm going to, whoops. There we go. Okay, the colors on the calendar too are set by the clinic. So we have our different appointments in different colors just for our own visual look. So here's the appointment with Antonio that I booked. When we click on it, we get a little summary. And we can use something called statuses to set the status of the appointment. So an example would be arrived or maybe a late cancel. We can see we have one set up with no show, 50% fee. Again, these are set up by the clinic. These are just some examples. With statuses, you can tie the generation of an invoice. So right now there's no invoice generated. When I mark him as arrived, it generates an invoice. So saving some time, it'll generate it in draft. And when I click on this invoice, we're going to see here are insurance options on the right, if they're enabled on your account. And on the invoice, you'll see the logo, your clinic information, patient information, invoice date. We can add additional notes if we needed to. Line items. So this was a 1-hour PT treatment. With me, it has all my registration information. It has the price, which was again set up on our account. We can add additional line items if we needed to. And we can add a payment if we needed to. So these would be the payment methods that we had set up. I'm not going to select one for now. We're just going to leave that blank. And then down here, we can just see a bit more information. So the subtotal, we can see it's in draft. We can see the amount due. And up here, under Telus eClaims, we can submit a claim or we can submit a predetermination claim. So if you wanted to find out if this appointment was covered before actually submitting it, you would select a predetermination claim and you'll get a response within seconds. Okay. We're going to submit this as a new claim. It'll auto-populate based on any previous information that was on this patient's profile. There's also a copy information from latest claim for this information. If the patient has secondary insurance, you can add that additional information. And then down here, payable to means who is the claim being paid to. So where's the funds going to? Is it the service provider, me, or the insured member? We'll select service provider. We're going to select the payment method of Telus eClaims. See, the service location was in person. And then there's some check boxes down here. Once we've submitted that initial information, on the left-hand side, we're going to see the summary of what we've submitted. And then we're going to add items. So we need to say what this appointment was for. So you can choose whatever it was that was done for treatment. These are provided by Telus. So these are not Embodia codes. These are Telus codes. So we also have a link here where you can learn about different service and product types, which is provided again by Telus. You can have multiple line items if you wanted to. And when you're ready, you have to agree to Telus eClaims terms and conditions. You've obtained authorization and consent, and then submit. You're going to get this little spinning wheel for a moment. And again, you can see all of the information. We can see that there was invalid credentials, so we'd have to go back and double check those credentials. Once it's submitted though, and it's been approved, the invoice will be updated so that it shows that it's been approved. Any questions there about Telus eClaims? Just going to have a quick look here at the chat. Yeah, I can see a question here about adding new patients. So yes, you can add new patients from the calendar. You can also add new patients from the My Patients section, or you could import a patient list. So there's a lot of redundancy within Embodia as well. But certainly from the calendar, you can add new patients, or as I showed you here, you can book an existing patient in for a consult. Okay, we'll move on to GreenShield. And if there are more questions about any of the integration options afterwards, we can come back to them. So similarly, for GreenShield, we're going to first book an appointment. So I'm going to click on the calendar again. And this time we'll book an appointment for Marianne. And same idea here. So we can book a consult, and we can do that not part of a clinical case, or we can book it under a clinical case, which again is just a grouping of appointments, which can be helpful for reporting and organization, as well as automation. So I'm going to click a new follow-up. The information is populated. Again, you can update it if you need to. And we're going to click submit. So now we can see Marianne's been booked here. And when I click on the appointment, same thing pops up here. We see a brief summary. We can use the status to indicate that she's arrived for her appointment. We'll also see that the appointment will have a additional little color here. This color is indicating the status. And these are again set up by you. So you can set up different colors. And when you hover over it, it's going to show you that it's an appointment and that she's arrived for that appointment. With this status, the invoice was generated. So we're going to go to the invoice again. The invoice looks the same as the previous invoice, with of course the difference being the patient information that's populated is based on this patient, not the previous patient. So this information always populates, as well as the appointment type, who it's with, credentials, price. So everything is automatically populated for you. You can still edit the content. So you can still come in and edit anything that you need to. And again, you can add a payment method. This time though, we're going to go and submit to GreenShield. So under the GreenShield tab here at the top, I'm going to click on new claim. Sorry, I may need to go look up this Marianne's. Let me just find her. Plan member ID. Okay. So we have her plan member ID. We can actually see that there's 3 plan members under this one ID, but we're going to select the patient, Marianne, and me as the provider. Similar to GreenShield, you can select who is receiving the payment for this claim. So is it the provider, is it me, or is it the plan member? This, of course, would be different. If you're collecting payment from the plan member, from the patient, then the payment should go to the plan member. If you're not collecting payment, then the payment is going to the provider. For this one, we'll just select it's going to the plan member. And this way I can also show you how to collect a credit card payment. So in this scenario, we're going to say that Marianne pays us directly in the clinic. And we are going to send the GreenShield payment to the patient. This question is also standard from GreenShield. We're going to say no, she doesn't have other insurance, and no, it's not related to a motor vehicle accident. If she does have medical prescription, then you can add that here. Similar to Telus, you're going to add items for what was provided for this patient. And just for the sake of time, and again, you agree to the kind of GreenShield's terms here, submit to GreenShield, and then again, you'll get a response in a moment. So we can see this actually matched her, the service that was provided with how much she's covered for. So the submitted amount was 85 and the approved amount is 80. Since the payment was going to Marianne, she's going to receive the payment from GreenShield. We still need to collect payment from Marianne, which we can do directly on the invoice. So I'm going to add a payment method here, and we'll choose credit card so you can see how this function works. If Marianne has a credit card on file, then you can select it, which she does. So she has a credit card on file, so I can complete the purchase. If I wanted to add a new card, I can simply add a new card. to her profile here. Oops, sorry. And then we're going to complete the purchase. Delete the extra payment method. So now we can see that she's paid by credit card, $85. It's paid in full, and we can email the receipt to her. And we've done the direct billing for her to GreenShield. So she doesn't need to submit this invoice to GreenShield. She'll get reimbursed the $80. Any questions about GreenShield billing? Yeah, so I see a question here just about what's coming up on the forms when we're submitting claims. So for all three, actually, the information on the forms is provided by Telus, GreenShield, and HCAI. So this is not created by Embodia. The feature on Embodia allows you to do your billing directly in one spot, but it is still the information that is required by these providers, by Telus, by GreenShield, and by HCAI. So we're not allowed to change those forms, for example. So exactly what you see on a new claim, this is all provided directly from Telus. And we have to follow the way in which they're providing that information. The benefit of doing this all through Embodia is it's one central spot. So you're doing your billing all in one spot, and you'll keep track of all of your billing, invoices, receipts, payments, all in one place. I see another question here about admins. So yes, I'm logged in here as the clinic manager, which is the practitioner account on Embodia. You can also have admin accounts on Embodia. Admin accounts are free, and I just went here to my clinic general info. We can see that I'm the manager of this clinic. There are 3 practitioners, including myself, and we have 2 admins. The admins can log in to Embodia from the admin portal. Again, these accounts are free, and you can choose to set your permissions for clinic admins. So clinic admin permissions look like this. One of them includes the ability to manage patient billing. So you can give one admin the ability to manage patient billing, but not everybody. You can give everybody that permission, and that allows them to do everything that I've been doing during this webinar. There's also a variety of other permissions, so you can really set up your account to meet your needs. Great, you're welcome. Okay, last but not least, certainly, is HCAI. So if you are an Ontario clinician and you see patients who've been in motor vehicle accidents or MVAs, then you can use Embodia to do direct billing to HCAI, Health Claims for Auto Insurance. That's what that stands for. And the first step to using HCAI is setting up your initial settings. So HCAI settings. And as mentioned previously, there is more involved with this setup. So under HCAI settings, we have credentials, which is what we had also for Telus and GreenShield. So you will need to have an account with HCAI, and once approved, you will get all of this information from them. You will also have the ability to edit your account if needed, and you can add additional providers. Then there's a whole bunch of other tabs along the top here, and this is designed to make your life easier. If you're familiar with HCAI, then you know that there's injury codes and intervention codes, which you can set up here. Okay, so you can set up as many as you need. HCAI has a lot, so setting up just the ones that you use would be advisable so that you don't have a lengthy list. Same for intervention codes. Okay, so we can see that we've set up the MIG, the minor injury guidelines. We've set up some other intervention codes. And then a very helpful feature that is very much appreciated by clinicians and clinic admins is templates. So with HCAI, there's different forms that need to be submitted. And all of these forms, again, are provided to us by HCAI, and you can actually set up a template. The reason for doing this, you'll see in a moment, is when you're actually using or setting up a claim for a patient, you can use one of the pre-populated templates. So this is an OCF 23 or a MIG that we've set up as a template. So maybe these are the common injuries that we use when we see somebody under the MIG. And these are the ways that we typically answer these questions. So it's just simply a template. And again, I'm going to show you how we use this with a patient. Case tags are also helpful. You can set up as many case tags as you'd like, and it's just simply giving it a name. You'll see this in action in a moment as well. So we can see we have concussion. We have 7 cases under concussion. We have 1 case under vertigo, and so on. Adjusters, you can set your adjusters here because it'll just help again on filling in the forms. And then general settings. This is very much appreciated by clinic admins. So you can set a threshold notification. So clinic admins who manage invoices are notified when there's a certain threshold met on an invoice. So for example, if you're under a MIG, there's a $2,200 limit. If a patient is reaching a certain limit, then a clinic admin can be notified so they know it's time to submit a new form, for example. So they don't have to manually go in and check on all of that. Okay, we are going to go have a look at a patient profile under My Patients. And we're going to look at Charlie. So every patient has a profile on Embodia. And on that profile, there are many different tabs, including a billing tab. So this is the billing tab as it relates to Charlie Brown, to this patient. Under billing, we can see that there's various drop downs, all invoices, policies, if you wanted to save insurance policies, packages and memberships. If you sell those at your clinic, then there's an option to do that. Cards on file, these are credit cards on file. We can see we can remove it. We can add new cards from here. Telus eClaims and HCAI. Under HCAI, the first step is to set up a new case. We can give that name October 1st, 24. And here we can use tags. So this is really for tracking purposes. Let's say 1, 2, and vertigo. So here's our new case, and then we can add documents to that case, such as a new OCF 23. So we can give it an internal name if we want, or by default, it'll be today's date. We're going to add the claim and the policy number, accident date, and then we can select a template. So we have 2 templates to select from. I'm going to choose the OCF 23 template. It's going to fill in this information for us. We already had all of this information on the patient's profile, so it auto-populates it for us. And since this is the first claim we're making, we need to fill in this information about the insurer and the adjuster. You need to select if there's other insurance, and then we're going to go through and fill in this information. So we can see that it's selected our service information for HCAI. And if you've used HCAI before, then you'll recognize that this is all standard information on their MIG form or their OCF 23. Now here's where the template comes in handy, because these are general questions. So they've already pre-populated for us from the template. If we needed to add more, we could add more, or we could remove for this specific patient. The form is auto-populated based on our template, but again, we can edit it if we need to. Okay. Enter date. Okay, you can see this is also populated. We're going to say and then the last page if there's any attachments, but we will save this form. We can see that if we've missed anything, it's going to say some information is missing. So we'll go back in and edit in a moment. You can also request a signature from Charlie. So this will provide the form to them. They can sign it electronically and send it back to you. So without having to print it, without having to do it in the clinic, you can just simply click the request signature. Let's say, once he's signed it, this notification will be updated to he signed it. Anything that we've missed will be in red. I believe we filled everything else out. Okay. When it's complete, the document's complete, then you'll be able to submit the document to HCAI. It'll take a moment for it to give us a response. So we're going to head over to the calendar again, and we're going to book Charlie's appointment in. We'll book Charlie's appointment in for tomorrow. So again, I'm going to click on the calendar, type in Charlie's name. We'll use a clinical case that's already been set up. And we'll select, we'll do a PT assessment. Let's do that again. Okay, we need to submit this before. It didn't quite go through. Let's just go and see if we can update that. Might just be, we need a space. Give it a moment. Any errors here? Okay, now it's been successfully submitted. So we can see that there was success in the submission, which is great because now when we click on the appointment for Charlie, there's going to be this additional section here where we can associate this appointment with his HCAI plan item, which was submitted. So the initial HCAI plan needs to be submitted so that we can associate the invoice to it. If you haven't submitted the HCAI plan and you're setting up appointments, that's okay. You can come back later and associate the appointment to that plan. Okay, so here's Charlie Brown's appointment. Again, we can click on it. We can see that he has an appointment. Markham has arrived. We'll just leave the invoice in draft. What I'd like to show you is back on this patient's profile. So we're back to Charlie Brown's patient profile here. And under tracking, we can see the minor injury fee. We also had the $400 for supplementary goods and services. So everything is tracked in one spot. And now we can see that we have one pending invoice, which is the appointment that we just set up. So this is how associating your appointments to an HCAI plan is going to be helpful. Again, if you went and set up appointments before you had submitted the HCAI plan, it's not a problem. You can come back and add them. You can see there's a little add button here. It's in red because we haven't actually submitted this to HCAI yet. So that's the difference. There's all kinds of tracking that will take place, as you can see. So submitted, once it's approved, you'll see the approved amount, and then invoiced amounts. This is how much we've actually billed to HCAI, which will get populated as we actually bill HCAI. Any questions about using the HCAI features? Yeah, so there's a question here about billing HCAI, which is a great question. So the OCF 23, yes, is the treatment plan, what you plan on providing. Then there's the invoices on Embodia, which are based on the appointments that are offered or the appointments that the patient has come in for. And then you're going to have invoices that are sent to HCAI. And those are the OCF 21B and 21C forms. So this is something that you would also set up, that, again, you can use as a template. This is this is, I'm not sure why we're getting that error, but essentially you can set up your 21Cs so that then you can bill, there we go, HCAI for the treatment provided. So yes, you would do all of that as well, which is required. And again, you can go through and fill in all of the information. We can see I've started my 21C. It's not ready to go yet. You can't submit it until all of the information is there. As you would have seen before, when I had missed some information, we can't submit it with incomplete information or incorrect information. And then as you can associate patient invoices to this and then collect payment from HCAI directly through the system. Okay, so now we can see we have 2 forms for this case that was set up for Charlie Brown, and one's in draft, one's submitted, and then everything will be calculated for you here. Any other questions? We're really coming up right to time. Oh, how much does the software cost? That's a great question too. So it's $45 per month for a practitioner. We do have a pricing page here. I just put that in the chat for you. Thanks, Sheena. The pricing breakdown is here on this page. If you're looking to use our practice management system, then you would be looking at the tier 3 membership. It's $45 per month per practitioner. It includes all of the features. We don't have any hidden features or hidden fees, rather, and it includes everything. So charting, scheduling, billing, and invoicing, the direct billing features that I've showed you today, and many other features as well. So waitlist management, you can run classes, you can do tele-rehab, packages and memberships, there's reporting. And if you do have part-time practitioners, we do offer part-time pricing as well. Wonderful. Yes, so there's another question here about patient intake forms. Yes, those are available on Embodia that patients can automatically fill out themselves. And I'll show you what that looks like from a mock patient that has filled out some information. So again, each patient has a profile. Intake forms can be sent to patients, as well as outcome measures and satisfaction surveys. We call all of those questionnaires. So anything a patient might fill out, we can see that this patient has been sent a lot of different forms. It's going to show you the questionnaire type. If the questionnaire also has scoring attached to it, it's going to show you the score. Whoops. The date it was completed. And if something's been filled out more than once, I believe this one has, yeah. You're also going to see change over time. And you can see all of their answers. So that would be more for intake, for outcome measures. If you have intake forms, you can see here, she's completed this intake form. It was very short. But yes, you can easily send digital intake forms for patients to complete on their own time. And you may have missed this at the beginning, Sheena. There's a bunch of templates. So questionnaire templates are available that you can use, or you can build your own from scratch. So here you can see all of our templates available. There's a lengthy list. You can use any of these. When you're using any of our templates, you can then, this is a preview of what it looks like. If you're going to go and use it, it gets added to your account and then you can edit it. So you can edit it to meet your needs, or you can build one from scratch. Transferring is generally very straightforward. So we do have import features. So you can import a patient list, you can import charts. And when you import patient lists, you can include any information you'd like. So like demographic information is typically imported. Other kind of information that doesn't typically change, that would be on a patient's profile, that can all be set up to be imported. We also have our tech team who looks at all of the imports that come in to make sure that they're properly formatted. You can see that we've made 2 imports. When you do an import, it's a CSV import. So you would need to export this from your previous system in order to import it. But we give you all of that information when you're getting started. And if you need help, then we're here to assist. Hey, you're welcome. I will send a follow-up email. And if you do want to get in touch, that's our support email in the chat. And I'll include in the follow-up email a way that you can book a demo. So if you're interested in booking a time to meet with us one-on-one and to be able to actually ask us questions, then you can do that because I know in this webinar format, we just use the chat. But we also offer demos, and for anyone joining Embodia, we also do onboarding sessions where we look at your account with you and we help you set everything up. Wonderful. Okay. Thanks again, everyone, for joining. And I will send that follow-up email shortly. I hope you have